Welcome, ladies and gentlemen. My name is Refferty with the last three digits of my student ID 003. And in this student project of SGDB2, we are going to present about travel to cold climates. Next slide. This is the list of our group members. Next slide.
Hello, my name is Bernard with the last three digits of my student number is 103. Now, I will talk about the background. Traveling to cold climates poses health risks due to low temperatures. The human body has adaptation to conserve heat and protect against the cold, but humans are still susceptible to frostbite and non-freezing cold injuries. Effective prevention and management strategies include appropriate clothing, dry storage, nutrition, hydration, and specific treatments. Health professionals play a key role in travel medicine, emphasizing preventive care and post-travel screening for those exposed to cold environment. As you can see, these are the problem formulation. These are the general objective and specific objective, and these are the benefits.
Please let me introduce myself. My name is Julyvia Gifensius with the last three-digit registration number 088. I will now explain about the physiological responses to cold exposure. When exposed to cold conditions, the human body goes through a complex set of physiological reactions that are designed to maintain body temperature and ensure survival in harsh environments. One fundamental response is vasoconstriction, in which blood vessels close to the skin surface narrow to lessen blood flow to the skin. The body simultaneously starts to shiver, an instinctive muscular response that causes the skeletal muscles to contract and relax quickly, producing heat. When exposed to cold, metabolic rate rises, indicating the body's attempt to produce more heat and energy. Despite the body's physiological response, long-term exposure to extreme cold temperatures can still be dangerous and can result in conditions like hypothermia. That's all from me. Thank you.
Hi everyone, I'm Ngurah Bagus Bhismaka Ariel Putra, and my last three-digit numbers are 1 to 4. And now I will discuss about the epidemiology and risk factors of cold weather injury. The epidemiology of cold weather injury, including freezing and non-freezing cold injury in general population, is still mostly unknown. Studies of cold weather injury from 1980s until present largely focus on military personnel. Those studies show significant amount of biases due to incomprehensive data collection. For example, inefficient method of collecting years worth of data, and also data only being collected only from hospital administration. Despite the lack of sources about the prevalences of cold weather injury related to travel, data collected regarding the risk factors of cold weather injury in military personnel may be useful to be considered on general population. The risk factors of cold weather injury includes ethnicity, smoking, age, previous cold weather injury incidents, clothing, fatigue, cold water immersion, dehydration, exhaustion, improper acclimatization, sleep deprivation, insufficient nutrition, alcohol consumption, chronic diseases, for example diabetes and peripheral vascular disease, and also medication that impair compensatory responses, for example beta blockers, antihyperglycemics, and also general anesthetic agents.
Hello, my name is Ketut Uttami, and my last three-digit number is 048, and I'll tell you a little bit about frostnip. So frostnip is the initial stage of skin injury due to exposure to cold. Frostnip is the mildest form of cold injury and is an early indication to frostbite. It can occur when skin is exposed to extremely low temperatures, frequently combined with windy conditions, or when skin is contact to cold surfaces. The tissue is not permanently damaged and only the superficial skin becomes frozen. The frosty phase starts when the superficial skin cools down below 10 degrees Celsius, causing sensation loss, microvasculature constriction, plasma leakage, and an increase in the viscosity of vascular contents. That's all for me, and the next slide will be presented by my friend. Thank you.
Hi, my name is Niputu Diah Urmila with last three digits of student ID 301, and here I'm going to explain about frostbite. So frostbite is a severe injury caused by exposure to sub-zero temperatures, leading to vascular damage and potential amputation. Frostbite, identified in a 5,000 years old Chilean mummy, frostbite gained prominence during World War II. Originally affecting military personnel, frostbite is now more common among civilians, especially those who are poor, alcoholics, or face mental health challenges. Frostbite manifests as a dark purple skin scalds, numbness, and clumsiness. Long-term consequences including chronic discomfort, sensory loss, hyperhidrosis, cold hypersensitivity, and distal amputation. There are four degrees of frostbite: the grade Y injury or superficial. It's redness and edema without necrosis, occasional skin desquamation after 5 to 10 days. The grade 2 injury or partial freezing of the skin with the characteristic hyperemia, edema, erythema, blistering, necrotic skin sloughing, and discomfort during rewarming. And the grade 3 injury or full thickness skin is the complete skin damage, burning after rewarming, erythema, and decreased feeling. And the last, the grade 4 injury or tissue beneath skin is affecting muscles, tendons, and bones, leading to potential permanent impairment or amputation. So that's all I can explain about frostbite. Thank you.
Hello doctor and friend, my name is Amelia Sasikirana Dewi, with last three digit 207, and today I will explain about hypothermia. Hypothermia is a condition where the body has a temperature below 3 degrees Celsius. Cold injuries due to hypothermia primarily affect elderly adults, homeless or drunk people, adventurers, and military personnel. Hypothermia adversely affects the function of many organs, including heart, brain, kidneys, blood clotting, and possibly the immune system. That's all from me. Thank you.
Hello, my name is Putu Sri Pururaswini Astawa, and my last digit number is 2161. Trench foot categorized as a non-fresh and cold injury typically arise from prolonged exposure to cold, often above freezing, damp, and unsanitary conditions, resulting in eventual breakdown of skin and tissue. The pathophysiology of trench foot involves varying vasoconstriction and vasodilatation, leading to local tissue damage. Trench foot predominantly affects the heels or toes with potential extension above the foot. Initial symptoms include tingling and itching progressing to numbness, significant swelling, and in some cases doubling in size due to edema. Early identification and treatment of French foot lead to complete recovery, though temporary pain during duration of sensation may occur. Thank you.
Hello, my name is Julyvia Gifensius, and the last three digits of my student ID numbers are 212. So, Raynaud's syndrome or Raynaud's phenomenon, or RP, is an episodic vasospastic condition causing impairment and affecting about 80 to 19% of people. Primary RP or PRP is an idiopathic and the most common type, while secondary RP or SRP can result from various illnesses and drug-related factors. RP attacks are characterized by episodic color changes in the hands and feet due to low temperature or mental stress, and the main symptoms include blue or cyanosis, redness, initially white or paler from vasoconstriction. Patients do not need to undergo all three color changes, and reactive hyperemia is less common. RP can also impact the vascular beds like the lips, nose, ears, and nipples. That's all for me. Thank you.
Hi, my name is Skylenn Hertanto Tan with the last two digits of my serial number is 145. And today I will discuss about chilblains. So chilblains, also known as perniosis, is a medical condition that affects the skin in response to cold temperatures. And chilblains occur when the small blood vessels in the skin become inflamed after exposure to cold but not freezing air. This can happen when the skin is suddenly warm after being cold and causing the blood vessel to expand and leak. The exact cause is not fully understood, but is thought to be related to a combination of cold exposure and individual susceptibility. And the symptoms of chilblains typically includes redness, itching, swelling, and possible blistering on the affected areas, such as the toes, fingers, nose, or ears. In extreme circumstances, the ulcer may form on the skin. And so, once the skin is warmed up, chilblains usually heal on their own in a few weeks. And however, it is advised to apply calming creams and refrain from scratching and keep the afflicted area warm in order to reduce symptoms. And also, in order to prevent infection, medical intervention could be required if the symptoms are severe. Maybe that's all from me. Thank you.
Now we are going to talk about the prevention and management of cold injuries. In this project, we are going to talk about the prevention and management of frostbite and foot. There are many similarities between those two cold injuries, and it can be summarized as this. First, the prevention. Travelers should wear adequate clothing, including mittens, warm shorts, and boots. And then travelers need to take an extra care to protect any exposed skin, while also maintaining dryness, ensuring good nutrition, and preventing dehydration. And then travelers need to be alert for incipient frostbite, especially cold or numb fingers, toes, or white appearance on the nose or ears. And then supplemental oxygen at extreme altitude may be necessary to prevent frostbite. In addition, we need to limit our exposure to cold temperature. And then moving on to the management. First, if there are hypothermia present, we need to take care of it. And then we should rewarm any incipient frostbite by immersion in warm water for 15 until 30 minutes. And then by then, the skin should be dry by air to prevent further tissue damage. And then as an AID, such as ibuprofen, may be used for controlling pain and preventing further inflammation. And then for the treatment, we need to elevate and protect frostbitten extremities. And then if there are compartment syndrome, we need to do fasciotomy. And then we need to aspirate or debride clear blisters. And then if there are hemorrhagic blisters, we must not open it. And then we need to do volume replacement as necessary. That's all from me. Next slide.
Hello, my name is Agung Kesuma, and the last three digits of my student ID number is 181. I will explain about the roles of healthcare staff. So, travel medicine is an evolving dynamic specialty focused on travel-related illnesses and health standards in various countries, and it is why healthcare staffs must stay updated on the changes worldwide. So, healthcare staffs must focus on pre- and post-travel prevention on traveler. In pre-travel, consultation is important. In consultation, medical advice is given to travelers to discuss illnesses and how to avoid it. And also vaccination and immunization to prevent disease transmission. Meanwhile, in post-travel prevention, screening is important. In screening, it includes detailed medical interview about traveler symptoms after traveling. That's all from me, thank you.
My name is Putu Sri Dianingsih and my last sheet on my student ID is 017. I'll continue with the summary. So human body goes through some physiological reaction when exposed to cold conditions, such as vasoconstriction, thermogenesis or raising the body's core temperature by shivering or non-shivering thermogenesis, rising of metabolic rate, cold diuresis, and cold acclimation. In the general population, the epidemiology of cold weather injury is still mostly unknown. Cold injury is divided into freezing cold injuries and non-freezing cold injuries. Freezing cold injuries are frostnip, frostbite, and hypothermia. In frostnip, The tissue is not permanently damaged, only the superficial skin becomes frozen. In frostbite, there is a vascular damage which can lead to thrombosis, ischemia, gangrene, and the need to amputate the damaged tissue. Frostbite appears as a deep scald, dark purple skin, and scabs. Hypothermia adversely affects the functions of many organs. Non-freezing cold injuries are trench foot, Raynaud's syndromes, and chilblains. In trench foot, because of the prolonged exposure to cold, there are breakdown of skin and tissue, erythematose or cyanotic feet, and edema. Meanwhile, in Raynaud's syndromes, there are cyanosis, redness, and pallor. Chilblain symptoms include redness, itching, swelling, blisters, or ulcers in worse circumstances. The relevancy of travel medicine goes beyond ensuring individual well-being to addressing broader global health challenges. The role of healthcare staff is to manage the health and safety of individuals before and after the travels. That's all from me. The next will be continued by my colleague.
Here is a list of references that we have gathered in order to make this student project. Next slide. Plays off from our presentation about travel to cold climates. We are sorry if we had said something wrong or inappropriate. We hope that the audience can get a lot of new knowledge and insights. That is all. Thank you for listening until the end and have a good day.